The Regional Hospital Bamenda on March 12 and 13, 2024 carried out free glaucoma screening in commemoration of the World Glaucoma Week.
We've known that actually glaucoma is one of the leading causes of irreversible blindness. And so this is a very important thing when we know that the eyes are really very important for the body. And so we thought it wise that we cannot stay back. Having all the specialists, having our ophthalmologists here, we have been receiving cases of accidents. We have been signing driver's license, medical certificates for driver's license, and many people are not having good vision.
According to health experts, glaucoma is a health defect that damages the optic nerves which connects the eyes to the brain.
To simplify things, if the eye was a camera and the brain was a computer, the optic nerve is the cable that connects this camera to the computer. Glaucoma is a disease that affects this optic nerve and it can occur at any age. In Africa, we see that everybody with is black-skinned, and that is 40 years old, and most especially in males, is at risk for glaucoma. Anybody that has a first-degree relative, meaning a sibling, a mother, or a child that has glaucoma has a 4 to 8 times chance of having glaucoma compared to somebody that does not have this family history.
Being a silent theft of sight, most people are unaware that they have glaucoma, which causes irreversible blindness.
Glaucoma is the first cause of irreversible blindness in the world. Most patients that have glaucoma don't know that they have glaucoma. You can have visual field defects in the periphery of your visual field and not feel it. So until the visual field defect gets to the center, you will not realize that you have glaucoma. However, there are few pointers to show that someone might have glaucoma. If you have a painful eye, a red eye, you have constant eye pain that is associated with headaches, or when you look at lights, you see halos around the lights, or you have a hypersensitivity to bright lights. These could be pointers that maybe you have glaucoma.
During the 2-day screening campaign, the ophthalmology unit of the Regional Hospital Bamenda received a good number of clients.
We've seen a lot of patients with glaucoma that did not know that they had glaucoma. Glaucoma is a disease that affects about 70 million people in the world, with a high prevalence in Africa. In Cameroon, about 4.5 to 8.9% of the people that visit eye hospitals have glaucoma. Here in the regional hospital, we have unpublished data that shows that about 6% of the patients that we see in the eye department suffer from glaucoma. This totals to about 60 patients a month. That's a high number if you consider that what we see here in the hospital is just a tip of the iceberg, and the community, which is not screened, nobody knows what are the numbers in these communities.
Given that there is no sign and symptoms of glaucoma and no cure as of now, the population is advised to visit the hospital regularly for screening.
To detect glaucoma, you have to go to your eye care provider like we are doing today, who will do a test, who will check your vision. They will measure the intraocular pressure in your eye, and they will also look at the back part of your eye in a test called fundoscopy to look at the optic nerve itself and to assess if there has been damage to the optic nerve.
It is important to note that with early detection of glaucoma, a lot can be done in order to avoid further damages.
It has been shown that the earlier we detect the disease and we start treatment, we can preserve the vision of people that are affected with glaucoma until the day that they naturally leave the stage of the world.
You don't wait for pain. Come every year to the ophthalmology department and have your eyes checked. Please find time to come and check your eyes. And if you are found with glaucoma, know that the entire family needs to be regularly checked.
This year's edition of the World Glaucoma Awareness Week is commemorated under the theme Uniting for a Free Glaucoma War.